Hello and welcome to another episode of Clean Talk. We're coming to you live from the Seal Shield Studios in beautiful downtown Orlando, Florida. Very excited to have our guest on the show today. You know, we're an infection prevention podcast, so we love to get infection preventionists on the show. Our guest today is Priya Pandya-Orozco, and she is the Infection Prevention and Control Nurse Manager at O'Connor Santa Clara County Hospital. Priya, welcome to Clean Talk.
Thank you so much for having me today.
We are so excited to have you on the show. I know from our pre-interview that this is going to be a fun show today. I really am impressed with some of the exciting and fun things you're doing in infection prevention, and that's not something you hear a lot. So I know that our audience will be very excited to get some insights from you today. Priya, can you tell us a little bit about your background and why you're on Clean Talk today?
Yeah, absolutely. So my name again is Priya Pandya-Orozco, and I'm a nurse manager for infection control here at one of the three hospitals at O'Connor, which is O'Connor Hospital in the Santa Clara County Health System. But I've been a nurse for about 25 years, and I think what brought me in is I've always had a passion for nursing and for communicable diseases. I started back in the day as a public labor delivery nurse, and then moved into the public health arena, and quickly moved into a immunization director role for one of the nearing counties. And then after that, I really started to see, like, you know, again, as we see all over, how prevention can really be, how we can prevent diseases from spreading. And being in a communicable disease setting sector of public health, it was kind of an easy win to kind of go, if I wanted to go in the acute care, where would I go? And it was easy to think of infection prevention. So that's where I landed and where I've loved being ever since for the last 12 years.
Well, we like to think that we're very passionate about infection prevention here at Clean Talk, but I've got to say, you're one of the most passionate infection preventionists I've had the pleasure to talk to, and I can't wait to share with our audience some of the things you've done culturally to have success in infection prevention and healthcare. But tell me first about the APIC Film Festival. We're big fans of APIC here, and we promote them a lot on this show. They're doing a lot of great things to get more infection preventionists into the field. I was not aware that they had a film festival. What is that about?
So the film festival is a way for, you know, infection preventionists to basically kind of play games and create like a song or something that's important maybe for our performance improvement measures, such as maybe PPE donning and doffing, or in our case, hand hygiene. And so what we did is we wanted to make hand hygiene, and we wanted to make everything that we teach fun. Right? Fun to teach, because when you learn, when we think about when we learned as children in kindergarten and preschool, we gamed a lot of what we learned, and we remembered it. We sang the ABCs and the 1, 2, 3s, and so that's kind of where our methodology was here to say, you know, why don't we do that here? So we have this little fun first slide of our presentation when we are sharing our performance improvement on hand hygiene, and we say hand hygiene, make them dance. And so that
literally make them dance. Okay. Wow.
Literally make them dance. So what we did is we contest, and we said to take a very popular song, change the words to fit the 7 steps of hand hygiene, and we gave instructions on what those 7 steps would look like, and even visual aids to show this is what it looks like. And so they changed the words to certain songs, and then they had to also dance in the video. They had to be a video, so they'd send the script of the words, and they had to sing in the video, and they had to dance, do something to show that they understood the 7 steps of hand hygiene, whatever they decided to do. So we had 7 submissions throughout the hospital, and then we had a core of judges that selected the winning video. And then what we did is we remade the video using every department and almost every shift in the hospital so that everybody had their face forward on this flash mob. And at the end, we decided that we wanted to present this at World Hand Hygiene Day, which was in 2021. And so we celebrated this with QR codes all over the hospital and banners so that people could share it. And it was a lot of fun and enthusiasm. And we knew that there was a film festival for APIC. They've had this, as we know. And so we decided to submit for a possibility of winning. And we were extremely thrilled and blessed that this year we were selected as the grand prize winners for the film festival. And again, this journey was not done by just infection control alone, was done with an amazing hospital leadership team, frontline staff that are amazing to work with.
I think that is fantastic. Now, can we check out this video? Is this on YouTube? Can our audience go see this video somewhere?
Absolutely. It's on YouTube. Yes. And we can share the link later.
Fantastic. We'll definitely do that. I want to see the infection prevention flash mob. Can't wait to check that out. Our guest is Priya Pandya-Orozco. If you have any questions for her, please send them in to the Q&A section on our chat. We'll take them live on the air. Priya, let's continue along the lines of gamification. I know that you've done some gamification outside of the film you talked about, incorporating that into your hand hygiene processes and procedures within the facility. What can you tell us about that?
So we wanted to make a phrase that saves. So that's what I've always like kind of made fun little quips about the contest names. A phrase that saves mean that in the moment I could help you see something that you maybe didn't see, which is like perform hand hygiene. So at other hospitals where we've done this process, I'll make an example. Like one had a double meaning. It was called, I'm going to tell you pause. So pause means pause in the moment, or it could mean puppy paws, but it stood for PAWS is how you spelled it. And it stood for please always wash and or sanitize. So if I saw Brad in the hallway, I could easily say, I don't know Brad's name, but I'm going to tell Brad, please pause for a moment, Brad. And he'd go, oh, okay, I got to do hand hygiene, because we have signage around everywhere telling what we do. We shared it in new employee orientation. It's part of our culture of safety. So it's something that everybody understood what this was. So we did the same thing here at O'Connor Hospital here. And so what we shared was we had a contest and they came up with Clean 20. The frontline staff said, I think if you said Clean 20 or somebody even said hashtag Clean 20, that I would know that means I have to clean my hands for 20 seconds and it'd be easy, and we could put it on posters forward facing. So we even have posters forward facing to our patients to remind providers and staff, please remember that our phrase that saves is Clean 20. Please say Clean 20 and we'll remember to do our hand hygiene. And they could remind us, and it's forward facing on every patient like board so they can see it from where they're sitting. It's also at the very front of every unit in the hospital, to share the compliance rate for that unit, as well as the statement of what Clean 20 means.
I just love it. I mean, not only are you gamifying it to make infection prevention fun for the practitioners, which who thought infection prevention could be so much fun, Priya, but also you're promoting it to the patients and giving them that sense of confidence that, yes, this is something we take seriously. And of course, that has to make you feel better when you're receiving healthcare in a facility like yours, knowing that it is a priority. Infection prevention is a priority within the facility. And it is a priority because it's fun. Who knew infection prevention could be so much fun, Priya? I know you talk about speak up safety culture and the benefits. This is kind of what we're talking about here, right? I mean, what more can you tell us about culture, or maybe some of the other fun activities you've done to enforce hand hygiene compliance and infection prevention procedures?
So we're really pushing forward like culture of safety at our hospital, and that goes so well in aligning with infection prevention, because it is about safety, but it's safety for the staff, safety for the patients, safety for visitors, safety for our providers. So what we do is we're doing some education on team steps, which is from the Agency for Healthcare Research and Quality. And I think what was really powerful about the team steps education is there's a fundamental practice, that module that's about communication. And so we've really taken our time to talk about like, how do we communicate? And again, Clean 20 is one way we can communicate. That's just one moment in time of what I should be saying about hand hygiene. But there's so many other instances that can occur that a great catch could happen if I just have that transparency and I have a culture that welcomes to speak up. So some of the games that we play are in team steps is you can make a paper chain. So it's a game where you could basically, you put paper, tape, and scissors on sections with groups, and you tell them, remember, you may want to go back in your mind, maybe you made paper chains when you were in kindergarten, and we show them an example of what that is. We don't tell them how to do it. We just say, here's a paper chain. Now we want you to go ahead and make the longest paper chain. You have 2 minutes. And it starts now. And then what you get to do is watch how they collaborate and really see like, who's that person in the role that takes the lead, right? In that group of 4 or maybe 5, who takes the lead? Who says, you're going to cut the paper, you're going to take the tape? Do they even do that? Maybe they don't do that. Maybe there's not speak up in that group. Maybe they're more introverted. But how do we get to that goal, right? The goal was to make the longest chain. But what really happened in that exercise is team building, right? And that reliance on and doing it together to win something, to get something. We're going to make the biggest paper chain, right? And they're having fun. they're having fun doing it. And that creates like the camaraderie that you really need to have there to really enhance the culture of safety, right? So we want to create a safe and a welcoming environment for people to learn and play, right? And also grow and be educated.
And I have to ask you, once you've created this paper chain, does everybody break the chain of infection then? That should be the next step. When you have these kind of team building events, and you're developing that culture, is it multi-departmental? Tell us a little bit about what kind of people are participating in these type of activities.
So we've just done a small group right now with one unit. So it's going to be, it was 3 sessions that we did this in, and then we rolled it out for that unit, and we're working on more units coming forward. But we also have a very robust hospital acquired infection task force. That's about 72 frontline, about 65 frontline, and about the rest are leaders. And leaders run each of the subcommittees. So we have 5 subcommittees underneath that for all different kinds of healthcare associated infections, such as CLABSIs, CODIs, SSIs, C. diff, and then we have our hand hygiene subcommittee. And really, it's, because we really know that performance improvement is sustainable only when it's really bought in from the front line, because we are not the leaders and the infection preventionists. We are not the doers of the work. We're here to recommend, be subject matter experts, and help provide any kind of consult that we can at any time. But those are the things that we really need the front line to take that and move forward. And so they're the best to decide what are the measures that we should do to meet those requirements for, let's say, maintaining hand hygiene at all of these encounters. If we have to do it when I touch a curtain, how do I do it when I touch a curtain, right? How do I access the central line? How do I best go in the room? There's so many things that can be involved, and that involves also the practice of understanding human factors, right? The human factors technology, what do you need to do to understand how the path of travel is for somebody when they walk into a room that they just came out of a supply room with? Where do they put the supplies down, for example, to do hand hygiene? Right? Did we give them something? And those are really great call outs that the staff have said, how do I put it down to do hand hygiene?
And
Or can I do it when I go in the room?
And there's so many vectors. I think having that greater awareness and getting to it through the gamification. And, I talked to a lot of infection preventionists, Priya. I can't recall another organization that has put so much focus on gamifying and bringing attention to this issue in a way that makes it a positive cultural impact. And you said you have 70 something people on your infection prevention task force. Is this typical? I have not heard of this level of focus typically in an organization. Am I just out of the know?
Well, I have to say this is a very special organization. I feel very blessed to work for the County of Santa Clara, and really the leadership has just been so supportive of really encouraging the participation. I mean, every month we meet for about 3 hours in these task force so they have the time to actually do the good improvement work, meet together, and new committees that form get to meet every 2 weeks so that they can meet time and work together on. Maybe they have larger improvements to do and they want to meet more time. So we really, I would love for it not to be unique, but I think that I feel very grateful to work here because of, again, the motivation and the inspiration to do the good work is really here. It's
Well,
really powerful.
I can understand why you're grateful. Who doesn't want to have fun while they're doing something important? And you're really onto something here. I'm excited about how we can expand this to other organizations. If you have a question for Priya, go ahead and send it in to the Q&A chat and we'll take it here on the air. Now, Priya, I know that you're doing all these fun activities and you're getting awareness around infection prevention in your facilities, but a lot of times it can be difficult. There's so many vectors for cross-contamination. How do you measure the results? What kind of results are you getting?
So for our hand hygiene, right? So after we started with the flash mob, initially we were pretty low in our hand hygiene compliance. But once we created this, again, the flash mob and the team building, because again, I didn't really talk about, but this flash mob created team building because the units had to work together to create these amazing videos. And so there was so much team building that went on that we saw right when we went live with the World Hand Hygiene Day, which was in 2021. That was almost, you could call it out. Like that day was May 5th, and that's World Hand Hygiene Day. from that point on, from May, for the next year and a half, when we were measuring all of this, our hand hygiene rates were above 90% for the entire year and a half. And we saw an amazing reduction in healthcare associated infections.
Wow.
So it was completely it was so relatable. It was so directly correlated. But what was really beautiful about it is that we circled back to our frontline and our leaders to share the data in real time, right? We wanted them to see what they were doing. So it wasn't like, oh, I'll share this with you at the quarterly. We wanted them to see monthly that look at what you're doing. Look at how you're moving the line. Look at how we're edging forward, and be proud of that. And we did hospital acquired days since for each unit, so that they could have like a tickler. They could look at they'd have a quality board that said, 150 days. We had units going 300, 250 days since the last HAI or CAUTI or whatever that metric was. And so what was really powerful was to be able to see that on the board and go, oh, wow. And they have to change the number, right? That tactile ability to go, I'm going to change the number. The posters that we created for Clean 20 that are forward facing the patients, they don't just say Clean 20, they also require us to write the percentage of compliance for our hand hygiene on that unit that last month. So you have to write 95%. And, a lot of our nurses like, I want to write 100%, right? They want it even more. So it's like that pride, that responsibility to come to work and to do the good work. It's powerful how it speaks when we become transparent.
Well, we're all marking our calendars for May 5th, Hand Hygiene Day. Hand Hygiene Day, the same day as Cinco de Mayo. Coincidence? You decide. We're big fans here of Infection Control Today, the publication ICT. I know that you've done some work with them, reporting some of your hand hygiene findings. What can you tell us about the work you've been doing with ICT?
So with ICT, Infection Control Today, we definitely did some great work with them. One of them was related to, we have a skilled nursing facility in our hospital footprint, and there was a recent AFL, all facilities letter that came out about infection preventionists. We need a full-time infection preventionist in every skilled nursing facility. So we have an amazing infection preventionist who did a ton of work with the amazing leadership and the frontline there in the skilled nursing facility to work on PPE donning and doffing, hand hygiene, and adherence to CAUTI bundle maintenance elements. And so what we saw was, as the education was tactile, involving champions, we saw them move the needle. And their hand hygiene rates stayed above 95%. They saw their CAUTI bundle elements stay above 95% adherence, and their PPE donning and doffing education was stellar. They had it down to science. So it was really a wonderful event to see and share with them the data. So we presented a poster presentation at the recent APIC conference in June of this year. And we were humbly and gratefully accepted for the poster was accepted, but also we were asked to be a part of the APIC press release. And so incredibly honored to be a part of that. And Infection Control Today, ICT reached out to talk to us a little bit more about that. And SNF is on the hot topic for infection prevention. Tell us more. So that's where we did that.
Well, great work happening at ICT and at APIC. And just a reminder, the APIC show will be here in our hometown of Orlando, Florida, in 2023. So we're looking forward to that. And I hope I get to see you there, Priya. What can you tell us about lessons learned from COVID? A lot changed with infection prevention in healthcare. The focus changed a little bit, maybe greater awareness. And then, of course, disappointingly, we've seen that while we were making progress on HAIs for decades, during COVID, the tide turned, and now we're having a few more challenges across the board, probably not in every facility, but what has changed as a result of COVID, and what are the lessons learned?
So, I have to just give kudos to the team here, because we actually saw the opposite here because we were pushing the needle.
Why am I not surprised? Why am I not surprised?
So we saw significant reductions, 50 to 75% in different metrics during that wave, because we were increasing our hand hygiene compliance. But we definitely saw with the NHSN CDC metrics that the nation did see an increase in HAIs and a lot of different things that were unavoidable sometimes with VAEs, and that's related to, like, sometimes our COVID patients couldn't move. We couldn't move them to do the elements related to ventilator associated events. But I think the biggest thing, that the takeaway is that infection prevention's always been there. I mean, we were celebrating our 50th anniversary with APIC this year. And a lot of times there used to be there's an infection control nurse, there's nurses in infection control, and they don't always have to be nurses too. A lot of our wonderful colleagues are epidemiologists, masters in public health. But what I think it brought to the surface is that, oh, wow, we really need to partner more. We always some hospitals knew that we were there, they always knew we were there, but I think the partnership became stronger with the COVID pandemic, the understanding to lean on us and to really see that the resources were very, very short in infection control in terms of the pool of infection preventionists. Some hospitals only have one infection preventionist for entire hospital system and clinic system. And that's, we can be subject matter experts, but if you don't go and see, you don't actually, so infection prevention is at the front lines, right? So we need to be where the work is being done. We can't be behind a desk putting data forward. We do need to do that as well, but we also need to be on the floor to talk to providers, staff, visitors, and discern what is best practices that you need. What do you not have? What are some gaps I see? What are some gaps that you see? And so that, I think, is what the COVID pandemic brought out, was like, wow, do we really have hand hygiene down? Do we really know when we're supposed to clean things? Do we know who cleans them? We have another mantra, as I said, we have clean 20. We have one that's we touch it, we move it, we clean it. And I think that's really important because it's the power of we, right? We can do this, and I'm going to help you. It's not you touch it, it's we touch it. So if I need to help you, I'm going to clean that for you, but that awareness, and I think the COVID pandemic brought into the world, the awareness of environmental cleanliness. It's not just hand hygiene. If the environment's dirty, it doesn't matter how many times I washed my hands, right? So who's the responsible person to clean that environment? And how do we clean? And what are the steps of cleaning? And we learn about C before D, cleaning before disinfection, right? So you have to clean a surface before you disinfect it. You can't just throw disinfectant on something that's dirty. So those are the things that we kind of are teaching in all of this process of gamification in the hospital. Is hand hygiene lent into the environment, right? Because then people, as they do their hand hygiene, they don't want to touch a dirty environment, a dirty surface. So then they're questioning, well, who cleans that? So it automatically just becomes its own performance improvement in just starting one. It's just beautifully rolls forward.
I love it. It's all about it's all 20, the film, the flash mob, the paper chain. What's next? Any other great tips that other facilities can be using to strengthen their cultures and improve their infection prevention outcomes?
So I think we're working on environmental cleanliness. And so as we talked about, we touch it, we move it, we clean it. We want really people to get into what does that mean, right? And to see the specialists, right? SPD is the specialist for instrumentation, and bringing them into the Healthcare Associated Infection Task Force, and EVS. Is environmental services, plays a huge portion of our healthcare acquired infection task force, and they are present at the meetings that come in. So I think the next phase for us is to let's look into the environment and what we can do together, and what partnerships can we make. And I would like to make even more grids, like who cleans what. Do we know who cleans what, right? Is it there an assumption? And right. Do we clean it per the manufacturer's instructions for use? Are we looking at that? And really looking at it, research and development, because I think that's the next phase of where infection control needs to be in, and also in construction, right? Where we're looking at those things and saying, well, if you're coming into a hospital system, and when COVID hit, the number one disinfectant recommended was bleach, and so a lot of people say, oh, I don't know if you can use it with this product. So this is where we need to kind of make the equipment more hardy, sturdy, to use the highest level disinfectant, or give really good instructions on what we need to do to maintain the warranties and still do the good work of cleaning and disinfecting.
Well, you said so much that's music to my ears that I don't hear enough of, that we really need to be looking at the facility level from the inception of construction on how we're developing facilities, and then the technology we're using to further our initiatives, right? So I think you have a firm grasp on these processes and procedures. It sounds like you're at another level than most of the infection preventionists I talk to. But what about technology? You mentioned research and development. Have there been any new technological implementations or anything technologically that you've brought to bear to help solve this problem?
Well, we are doing UV light disinfection, but that's not a new technology, but we are doing it and making sure that we're adhering to those practices, especially in, higher risk areas such as the ORs and SPD. And we've also brought in some UV air filtration. So aerobiotics, not to plug anybody, but we're using a UV air cleaning system. So we're doing that in some of our ORs to kind of add an enhancement as well to have that continually going during a procedure. And that's been, we're hoping to see that. We just started it. So we're hoping to see some incredible data coming out of there. The evidence-based practices that have been shared with us with the research has shown amazing and phenomenal changes in reduction of SSIs. So we're looking at that. That's where we're at right now. But, sky is the limit. There's so much out there with UV. I've seen some UVs that are they sit on top of the keyboards and they alert the keyboards are going to go off, and it lets you know that it's disinfecting the keyboard automatically. But those are things that I think it's going to be very interesting in the next year and next 5 years really to see what technology is going to come out to help us really keep the environment clean.
And don't forget C before D, clean that keyboard before you disinfect it.
Absolutely.
What are the UV applications you're using outside of the air handling? Are you using UV robots or UV for device disinfection or PPE disinfection? Can you tell us a little bit more about that?
Yeah, we are using UV robots, and we do that after certain terminal cleans in higher risk areas, like with maybe a higher level MDRO. We'll use UV robots. So we do have our UV robots. We use them in the ORs as well as in the decon room for sterile processing. And then we do also go through the hospital and doing supply rooms, doing a little bit of UV robot, putting the UV robot in supply rooms that need it on a quarterly cadence. We're working on those processes. We haven't gotten streamlined yet, but we definitely want to do that. But we are purchasing more UV robots to kind of make sure that we can do that seamlessly and with a cadence, a good frequency for all those.
Any more changes that you see coming about either in your facility or in other facilities in general to help with infection prevention?
I think, it's a very unique time and a very grateful. I'm very grateful to be in this at this time. As hard as it was in the pandemic, which we're slowly phasing out of it, but we're hoping that the flu season doesn't have the trifecta flu, RSV, and COVID. But I think it's going to be looking at like really the staffing, because that hasn't really been looked at. There's been some older research about one IP for every 100 beds. Things like that need to be looked at because now IPs are doing so much more. And it's not just data driven. It's not the only thing that we're doing. Prevention, as I said, is at the front line. So I think that looking at like, how do we build stronger staffing, leverage technology, and also build business plans for people to leverage and get more staffing for infection control so that we can have consultants in multiple areas, whereas instead of one, again, like I said, per hospital, there are many facilities that I know that only have one per hospital, and I really don't know how they did it except to lean on a lot of other areas. But I think that it's time to, and this will be where we're going to be going with bringing up the staffing matrix,
So
the staffing ratio.
I have to applaud you because you are doing more. I'm really excited about what I'm learning here today. But in your experience, what kind of obstacles have you come across? Is there one thing you would change that could help either in your facility or in healthcare in general?
I think it would be, so looking at electronic hand hygiene monitoring is definitely where we need to be moving towards, because it is great to have secret shoppers. And I don't think in my heart, and I say that I don't ever want the secret shoppers to go away, because we're not so secret. We actually, when we see something, if we see a gap, we'll talk to that person, do just-in-time training, or we'll celebrate somebody who's done a really great job. But I do think electronic hand hygiene monitoring will help us see where workflows aren't so great. Like we have staff coming up and saying, I need a shelf to put something down in. There isn't anywhere to come out to put anything down, and I can't do it. So, but those are things that we could see if we could see the cadence of how many times is it happening? Where is it happening? Where is it the most? And not for it to be punitive, right? For it not to be punitive about hand hygiene. I think that's where, like, working with ICT, I shared an article about, infection prevention and kindness. And I think that's another piece that we need to be really leaning in, because it's about compassion and kindness, and to know that nobody came in with the intent to do harm. But how do we help them do the work? And how do we help them do the good work and be proud of the work that they're doing? So those are the pieces that I think are going to be important.
Well, hand hygiene monitoring, it's very interesting. There have been a lot of solutions that have kind of emerged over the years, and none of them have really seemed to get the traction. What do you think the obstacle is for those solutions? Are they missing something, or is it just kind of developing a standard that everyone can agree on?
I think it might be the standard that everyone can agree on. And I think it might, I don't know. I mean, again, with our governing regulatory bodies, would they be willing to lean in and say, this is what we want? And really adhering to saying, these are the things that we want to follow? Because I think then that would help people provide a prescriptive way of, this is what we need to do, right? This is what we need to have. And if you take on this electronic monitoring system, make sure it has these elements, that would help, because we don't really say it, but it's like, which one are you following? World Health? You're following, CDC? Which one? Which hand hygiene? Are you doing the 5 moments here? Or are you doing in and out? And I think those are the pieces that needs to be just a baseline. It doesn't have to be like strict, but just a baseline. Must do in and out, and must, how does it remind somebody, right? Because there's different ways to remind. Some say alerts, with a flashing, and it's patient facing, so they can see it flashing too. So those are, I think it's just, there's so many different types of technology, but not one standard. And I think that we kind of need to come together to say, what is the best element? And whether or not we'll get that, I'm not sure.
Well, we've actually had a couple of hand hygiene compliance monitoring systems here on the Clean Talk show. You can check out those episodes by going to cleantalk.tv or checking out our archival episodes on YouTube. In closing, Priya, what are your predictions for the future for infection prevention?
I have a lot of hope. I have hope and passion that this profession of infection prevention will continue to grow, and that we'll be able to recruit. I have a innate dream and desire that every nursing school will, and maybe other schools as well, will incorporate a class in infection control, where they'll really learn a lot more about what this role is. Because, we do clinicals and different rotations like med surge, and I always wondered, why don't we do one in quality and infection control, or even risk? Why not all these areas? But again, with infection control, having a rotation of some sort, or a class, or a really regimented, standardized frequency to help really educate the incoming nurses. Because what I hear is they know about what infection control stands for, but a lot of nursing students don't know that we actually have a department and there's nurses in it.
Well, I have a follow-up to that, because all of these things that we're talking about and the things that you've implemented in your organization, they all cost money, right? So where's infection prevention budget coming from? Are you seeing an increase in budgets, or how do you reconcile that within a for-profit organization, as many healthcare systems are?
Well, we have many calculators that are out there in terms of the HAI calculator. So we utilize that in our infection prevention plan, risk and eval, which is an annual and a living document that we utilize. And we share, here's how much this HAI costs. So we share that on a regular basis with our executive leadership team, and they're very supportive. And I think that's also the importance that infection preventionists need to know how to write business plans, and how to really share the data to show the decrease, right? So when we saw a 50% reduction in some of our HEIs, to really quantify what that means. Right? What's that leveraging, that money, that monetary amount that it's leveraging, not including the fact it's like we have to look at the hospitalization, how many days were taken away. A lot of that needs to change, because even some of the calculators that are out there are not exact to like how much it costs to do healthcare in California, how much it does to do healthcare in Florida. And those are the things that I think still need to be tweaked a little bit more.
Well, I agree. And Priya, we have a comment from one of our audience members. Brandy Topman says that she agrees too, that infection control needs to be taught in school, all the way down to assessments of patients before ordering antibiotics. And that's something we didn't touch on, but the overuse of antibiotics. And I know that you've had an impact in that regard as well. Is that right? Can you talk about that?
Yeah, so which our alignment with our ASP, our antibiotic stewardship program, again, our infectious disease medical director is very involved in that and making sure that the prescription, when they prescribe and that they're adhered to. And we have a really high rate. I think it's a like 98% adherence rate to the recommendations that are provided by the ID pharmacist and the ID. So it's been really robust. But I think that that's kind of like, that isn't just, I've seen that in a lot of facilities though too, that the adherence to the recommendations have been high. So I think that people and the providers are really shifting and realizing that this is where we need to be looking at, and that review of all of the pathogens, and are we actually doing the good service of giving the right antibiotic to the right patient for the right time.
Well, Priya, I have to thank you for coming on the show today. It is very rare, maybe unique, that I speak with an infection preventionist and we're talking about gamification and culture, but clearly you're getting the results from that process, and I applaud you for that. Our guest today has been Priya Pandya-Orozco. Appreciate you being on the show today, and be sure to join us next week, Wednesday at 3 p.m. Eastern Time, when our guest will be Heather Hudson, CEO of Prevention ID. Priya, thank you so much for being on Clean Talk today. It's been a real pleasure. I'm your host, Brad Whitchurch, reminding you till next time, keep it clean.